The classroom shaped their minds, but the bedside awakened their hearts. In every touch, they discovered that nursing is not just a skill, but actually a calling. Good day, everyone. We're the Group 1A of BSN 3A. I am RENZ Agent ALBOR, together with my groupmates KATHLENE ALINTANA, JIMELPH APUHIN, ROBERTO ARROYO Jr., and Heart Austria will be presenting our research poster entitled From Classroom to Bedside, Insights into the First Year of Nursing Practice. The purpose of this study: the study aimed to explore the lived experiences of newly graduated nurses during their first year of practice.
For the instrument, the primary data collection tool for this study was a semi-structured interview guide designed to explore various aspects of the transition experience of newly graduated nurses. This format allowed for open-ended questions and follow-up prompts to gain deeper insight into the participants' thoughts, feelings, and beliefs. The interview guide consisted of three parts. Part 1 is the participant's profile. This section gathers socio-demographic information. Part 2 is the overarching question. This included the main question aimed at exploring the overall transition experience. And Part 3 are the probing questions. These follow-up questions were designed to further explore and clarify the responses to the overarching question.
The study employed the qualitative research design using a descriptive phenomenological approach to explore the lived experiences of newly graduated nurses, transitioning from academic learning to clinical practice. Data were gathered through semi-structured, in-depth interviews allowing participants to share their challenges, perceptions, and coping strategies. An interview guide ensured consistency while allowing open-ended responses. To maintain confidentiality, pseudonyms were used for all participants.
Participants were selected through purposive and snowball sampling, starting with recent graduates from the researchers' university and expanding via professional networks. The study involved 10 newly graduated nurses from private and public hospitals in Negros Occidental. For the inclusion criteria, the study included nurses aged 24 to 30 who graduated from the University of St. LaSalle within the past year. Eligible participants had 6 to 12 months of experience in general bedside care, handling minimum of 5 and maximum of 10 patients per shift, and were employed in either private or public hospitals in Negros Occidental, working fixed or rotating schedules.
Moving forward to the results and discussion for the demographic profiles of the participants, this study involved 10 newly graduated nurses from Negros Occidental, 5 from private hospitals, and 5 from public hospitals. Most participants were female, 7 out of 10, and aged 24, with all holding a bachelor's degree in nursing. In terms of employment, private hospitals had more full-time and regular ward nurses, 5 out of 10, while public hospitals had more contractual nurses, 5 out of 10, indicating a higher prevalence of contractual employment in the public sector. Work schedules also varied. Private hospitals nurses typically worked 12-hour shifts, while public hospital nurses had 8-hour rotating shifts, reflecting differences in workload distribution between sectors.
Out of the 10 participant statements, 4 major themes were identified and 3 sub-themes were made. For the first major theme, Theme 1, transition from academic learning to clinical practice. The shift from school to hospital practice is marked by anxiety, confusion, and a gap between theory and real-world demands. Strong mentorship and support are essential for professional growth. For sub-theme 1A, gap between theory and practice. New nurses struggled to apply classroom knowledge in clinical settings, facing challenges like managing patients and making real-time decisions. Yes, we learn theories in school, but the setup in an actual workplace setting is remotely different. For sub-theme 1B, overwhelming adjustment period. They experience emotional and physical stress from heavy workloads, fear of mistakes, and a fast-paced environment. It's really overwhelming. Sometimes you feel exhausted, but at the same time, it's fulfilling. For sub-theme 1C, learning through mentorship and exposure. Mentorship provided guidance, boosted confidence, and eased fear, though initial lack of support led to uncertainty and hesitation. I can honestly say they guide us a lot. They don't leave us alone and they're very hands-on. With that being said, a guided transition with mentorship helps bridge gap between theory and practice, easing the shift into clinical roles.
Moving on to the second major theme, which is the challenges faced by newly graduated nurses. New nurses deal with physical exhaustion, emotional stress, and lack of preparedness due to limited support. For sub-theme 2A, which is the physical challenges, long shifts and heavy duties cause fatigue and physical strain, affecting overall well-being. While on duty, you don't feel the exhaustion, but after your shifts, that's when you feel the fatigue and foot pain. For the sub-team 2B, which is the emotional and psychological challenges, anxiety, fear of errors, and self-doubt were common, especially when left to make decisions alone. The anxiety is there every time I go on duty. I constantly fear making an error in medication administration, like what if I give it to the wrong patient? Lastly, for the subteam 2C, which is the work environment challenges, inadequate mentorship and lack of preparation made new nurses feel overwhelmed and unsupported. Adjusting to the environment and becoming familiar with the workflow, it's really just a routine. When doctors get angry, some of them can be very demanding. With that being said, without proper support, new nurses faced heightened stress that may hinder their performance and confidence.
For Theme 3, Coping Mechanisms and Support Systems. To endure clinical demands, new nurses lean on peer support, self-care, and spiritual grounding. For Sub-Team 3A, Peer and Mentor Support. Supportive colleagues help ease anxiety, improve skills, and boost morale. One respondent emphasized the importance of peer and mentor support, saying, I can honestly, they guide us a lot. They don't leave us alone, and they're very hands-on. No matter how many times you ask questions, they'll always answer you. For Subteam 3B, Personal Coping Strategies. Rest, social support, and leisure activities help manage stress and promote balance. Another participant described their personal coping strategies by saying, at the end of the day, I learn a lot and I also include prayer. I cope through online shopping, going out with friends, and family. For Subteam 3C, Spirituality and Mindset Shifts. Faith and positive mindset give emotional strength and motivation to keep going. According to another participant, I was able to handle the demands of my responsibilities through my family and friends who became my support system and prayers. With that being said, effective coping and strong support networks enhance resilience and well-being among new nurses.
For Team 4, Future Aspirations and Career Outlook, newly graduated Filipino nurses view local roles as preparation for better paying jobs abroad. For Sub-Team 4A, the influence of international demand. Many aim to work overseas due to higher salaries and global demand for nurses. Compensation is one of the biggest factors in deciding to work abroad. It's not just for me, it's also for my family. For Subteam 4B, preparation for overseas opportunities. Local practice is seen as essential experience before pursuing work abroad. Communication and language skills when working abroad. Here, it's easy because we all speak the same language. And of course, improving my nursing skills. For Subteam 4C, the reality of nursing in the Philippines. Poor working conditions and low pay push nurses to seek opportunities elsewhere. The biggest factor is really the salary. I'm also concerned about the nurse-patient ratio. Handling 13 patients affects work-life balance and makes you question the quality of care you can give. With that being said, many new nurses use local experience as a springboard for better careers overseas due to economic and professional incentives.
For the conclusion of this study, the transition of newly graduated nurses in Negros Occidental, shaped by pandemic online learning, revealed significant gaps between theory and practice. Despite facing exhaustion, anxiety, and stress, they found strength in peer support, mentorship, spirituality, and family. Many nurses expressed a desire to work abroad, highlighting the need for improved onboarding, mental health support, and mentorship programs. While the first year was challenging, it was also a time of growth and confidence building for these newly graduated nurses. Their experiences point to the importance of better clinical exposure, structured orientation, and supportive policies to help new nurses thrive and remain in bedside care.
As for our recommendation, healthcare organization personnel may establish a more nurturing work environment. Nurse managers and supervisors may greatly improve confidence and clinical competence among new graduates.
Nurse educators may continuously review and update their curriculum to integrate more hands-on learning, simulation-based training, and real-world clinical exposure.
Newly graduated nurses may seek mentorship, ask for help when needed, and engage in self-care practices to manage stress.
For future researchers may examine different regional contexts, long-term career paths, or specific institutional practices that influence nurse development.
Lastly, patients. Patients at the heart of nursing care, and their outcomes may directly influence by the preparedness and well-being of the nurses who care for them. References can be scanned through the QR code below. And with that, we have reached the end of our presentation on our study entitled From Classroom to Bedside, Insights into the First Year of Nursing Practice. Thank you all for your time and attention. We wish you a pleasant day.